This is Jonathan from Fitness for Freedom. We're an in-home personal training company that specializes in giving you in-home workouts. Today, we're going to show you what to do when you hurt your back. So this is the acute phase. So what's happened is you've just injured your back from lifting something heavy up off the floor. Well, maybe not the floor, maybe it was something else. So I'm going to do a little demonstration to explain to you what's happening. So this is a vertebrae in my spine. This is the disc in between the vertebrae, and this is the one on the top. Okay, so what's happened is you've bent over, okay, flexing like this, probably twisting at the exact same time, which has pushed the disc out. Okay, when you push the disc out, it irritates the nerves that go down your hip and into your leg, causing a lot of back pain. So what happens is when that nerve signal gets sent down to your muscles, it's actually making your muscles tighter. So your muscles think that they're going to protect your spine by being tighter, when actually what we need to do is loosen the muscles up, and then also try to encourage the disc to go back in between the bones in your spine. Okay, so the first thing, what we do to encourage the disc to go back in is you want to lay down on your stomach. So this will be the most comfortable position for you to be in. When you first hurt your back, you'll want to stay probably as low as possible, but you may be able to go up even as high as both fists. So what will happen is that when you first get in the position, it'll probably feel slightly painful at first, but then it'll start to feel pretty good. And then after a little bit more time, it'll probably start to hurt again. When it starts to hurt again, that's when it's time for you to roll over. So you can roll over onto your back. So once you're on your back, you'll notice that one side is more painful than the other. So for me, for this demonstration, I will say it's my right side that is more painful. So what I want to do is take my right leg and put my ankle on my knee on my left knee. And I'm going to slowly bend this knee up, and I will feel a very strong stretch on the outside of my hip. Okay, so this is stretching the piriformis muscle. The piriformis muscle attaches directly to the base of your spine, and a tight piriformis muscle pulls on the bottom of your spine. So we're trying to stretch that muscle out so it doesn't pull all the time. So what you'll do is you'll hold this as long as you want to, at least 45 seconds, maybe a little bit longer. If it feels good, I would definitely recommend holding it longer, because this is the most important stretch you're actually going to do for your back. And the next stretch that you'll do is taking a skipping rope or a belt or whatever you have available and putting it around your foot. So that might be very challenging for you if your back really hurts, but you might have to loop it around and throw it over your foot. But I don't have to do that because I'm lucky. So now just gently pull your leg up as far as you can, and you'll notice that your hamstring is very, very tight. So you might want to release it a little bit and then pull it up again. And every time you pull it, you'll be able to pull it a little bit further. And if this is shooting into your back, or you get a shooting pain in your back, then just release it. You're pulling it a little bit too far. You don't want to push it. This is an injury that's probably going to take a couple of days, maybe weeks, hopefully not months, but I've seen it happen before where you've had to take months off. But if you do that stretch, that'll help your lower back. Okay, and the last stretch that we're going to do is to roll over on your stomach, push yourself up onto all fours, and it's my right leg that's sore, so I'm going to cross my left leg over so my knee touches the floor, and this might even be enough because it'll be too tight for me to push it back. But I'll try to push it back this way as much as I can and then just hold it. So in some videos you'll see people going down like this. That's not ideal because you're actually putting your spine into a little bit of a flexion, which pulls on, which helps the disc come out of your back, and we're trying to get it to stay sucked in. So you want to keep your spine as neutral as possible. And after you've held that stretch for about 45 seconds or longer, which I would recommend probably a little bit longer, you can go back down into your passive back extension stretch to help the disc go in again. So you might want to repeat this sequence 6, 8, maybe even 10 times a day if you're really, really sore. If you have trouble sitting down in a chair especially, then I would recommend doing this until your back starts to feel better. So that's Jonathan from Fitness for Freedom. If you know someone that hurt their back lifting, then I would share this video with them. If you found it useful, subscribe to our channel. And if you have any comments or questions, leave them below because we'd love to hear from you. Thanks for watching.